Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Cervical Health, Why is it important? Presented by Dr. Chung-Kuang Lin, family physician with Washington Township Medical Foundation. Dr. Lin is board certified in family medicine with a Bachelor of Science degree in biology at University of California, Riverside in 2016 as summa cum laude. From there, Dr. Lin achieved his medical degree at the University of Texas Southwestern Medical Center, Dallas, Texas. Returning to Riverside, he completed his family medicine residency at Riverside Community Hospital. Dr. Lin chose family medicine because of the variety that the field can offer to doctors. As Dr. Lin said on the topic, we get to be exposed to different areas of medicine. He also appreciates the trust in helping patients go through a wide range of issues, such as acute and chronic problems. Please welcome Dr. Lin.
Hello everyone, my name is Chung-Kuang Lin. I'm a family medicine physician at Washington Township Medical Foundation in Warm Springs, Fremont. Today I'm going to talk about human papillomavirus, or HPV. Most of us know about HPV because of cervical cancer screening that we perform routinely in women. HPV can also cause infections in the throat, anus, penis, vagina, vulva. And so today we're going to learn more about HPV. So first, what is the most common sexually transmitted infection in the United States? Surprise, surprise, it's HPV. That's our topic today. Usually when we think of STDs, we think of HIV, syphilis, gonorrhea, chlamydia. But HPV is actually the most common STI in the United States. The reason we don't think about HPV that much is because HPV is like many viruses, except for a few like HIV, where our body, for the most part, is able to clear the infection on its own. And that's why we don't think about HPV that much. Here are some numbers. So 79 million Americans are infected with HPV, and an additional 14 million are newly infected with HPV each year. Now this one is a lifetime prevalence, so looking at the population as a whole over the lifetime. So lifetime prevalence of HPV is pretty high. It's about 85 to 90% in men and women, and people who have at least one sex partner in their lifetime. Now these numbers are more looking at cross-section of a population. So let's say if we take a little chunk, a section of the population right now at this moment, about 1% of sexually active adults would have genital warts, and about 30% of a certain school-age children would have cutaneous warts, and that's skin warts, and that's more just through body-body contact in children. So just as we already mentioned, most of us with a robust immune system should be able to clear HPV infections on our own. So about 90% of people with low or high-risk HPV infections are able to clear the, 90% of the time, people are able to clear the infections within 2 years. It's not very clear whether it's complete elimination of the infection or if it's a case where the HPV virus is still in the body, it's just permanently suppressed by the immune system. These are more numbers looking at how our immune system is able to clear HPV virus infections. So up to 30% of genital warts spontaneously regress within 4 months, and 50% of cutaneous warts in children spontaneously resolve within 1 year. Just like many viruses, there are many different strains or types of HPV. there are around 200 types of HPV that we know of. Around 40 types can cause infections in human, and around 15 types are able to cause cancers. And that is mainly why we care about HPV, is because there are some HPV types that can cause cancers in the throat, anus, penis, cervix, vagina, and vulva, and that's the outside part of the vagina. So how is HPV spread? I think we already kind of alluded to how it's spread. It's a lot of skin-to-skin contact, be it just skin-to-skin contact in children or skin-to-skin contact sexually through vaginal, anal, or oral sex. Risk factors for HPV, again, pretty intuitive based on how it is spread. So people who have early sexual contact, multiple sex partners, history of other STDs, HIV infection, for people who are immunocompromised. So let's say if they have HIV or they're transplant patients on immunosuppressing drugs, or if they have some autoimmune conditions on some immunosuppressing drugs, or if they have diabetes, then those are some examples of people that are immunocompromised, and also not using barrier protection during sex. So as we mentioned, 90% of the time, our body should be able to clear HPV infections within 2 years. So it's actually the persistent HPV infection that we worry about. And that's because, let's say if someone gets infected with a cancer-causing HPV type, and that type persists, then that can cause trouble down the line. Some risk factors for persistent HPV infections are alcohol use and smoking. There are actually different societies with different recommendations on how often, who, at what age, HPV screening should be done. The main guidelines that gynecologists and other clinicians that perform Pap tests follow is this updated guidelines published by the USPSTF in 2018. So USPSTF is the United States Preventive Services Task Force, and then ACOG is the American College of Obstetricians and Gynecologists. ASCCP is the American Society for Colposcopy and Cervical Pathology. So USPSTF and ACOG came up with this updated guidelines in 2018, and that's also endorsed by the ASCCP. And this is the guidelines. So we routinely recommend cervical cancer screening for people aged 21 to 65. For people aged 21 to 29, if the testing is normal, then they can repeat it every 3 years. For people aged 30 and above, and if their testing is normal using the most up-to-date testing technology, then they should repeat the test every 5 years. The main difference is that people aged 30 and above, the most up-to-date testing is with HPV testing, and that's to test to see if there's any HPV genetic material, be it DNA or RNA. The reason that we don't use HPV-based testing routinely in people aged 21 to 29 is because HPV is so prevalent and so common, especially in this age group. And also, just as we mentioned, this age group, they have a robust immune system. Most of them are able to clear HPV infections within a few years. And that's why we do not use HPV-based testing routinely in people aged 21 to 29. Now, what if someone is older than 65? The current recommendations are that for anyone older than 65, if they've had 2 back-to-back HPV testing that's negative, then they are done with Pap tests. Or if they've had 3 back-to-back cytology testing that's negative, then they're also done. So it's cytology testing, that's our traditional Pap smear or Papa-Nicolau smear, where the sample is prepared as a smear on the slide, and a pathologist will look under a microscope and see if there's any signs of precancer or cancer. And of course, we want to know how we can prevent HPV infections. So certain things that we can do to help prevent HPV infections are limiting number of sex partners, delaying first intercourse until a later age, consistently using condoms to help reduce the risk. And one last thing is vaccine. So all the top items are behaviors that we can do, but there's also a vaccine that is available. The vaccine that's available in the United States for HPV is Gardasil 9. It protects against 9 HPV types responsible for more than 90% of HPV-related cancers, and it can help reduce risk of cancers in the cervix, vagina, vulva, penis, head and neck, and that's especially the throat. And so currently, the HPV vaccine is approved for people aged 9 through 45. Most insurance policies will cover the HPV vaccine for people aged 9 to 26. A lot of insurance policies nowadays also cover it all the way until age 45. For children, we routinely offer the HPV vaccine starting from age 11. That's when the tetanus shot and the meningitis vaccines are also recommended. It is most effective if the vaccine is administered before the onset of sexual activity. And the reason for that is if someone contracts an HPV infection, and let's say if it's a cancer-causing type, and for some reason this infection persists, then after they've already contracted this cancer-causing HPV infection that can persist, then the vaccine, given after that will be too late. And that is my presentation. This one is based on the American Academy of Family Physicians article published in August 2021 on human papillomavirus. Thank you all for your time and attention. Please let me know if you have any question.
Thank you, Dr. Lin. We do have some questions. The first question is, how effective is the HPV vaccination? Yes.
According to ACOG, or the American College of Obstetricians and Gynecologists, the vaccine is very effective. It's about 97% effective in preventing cancers. And that's for people who get a vaccine before they contract any HPV-causing, cancer-causing HPV types.
Okay, thank you. The next question. Can I get cervical cancer without HPV?
Most of cervical cancers are caused by HPV virus infections. According to some publications, more than 90% are caused by HPV infections. Some study even says 99% plus are caused by HPV infections. There are, however, some very rare instances where the cervical cancers can come up even without an HPV infection, but that is very rare.
Okay, and the last question we have, what is the most important thing to remember about cervical health?
So the takeaway points from this presentation, number one is screening. So we do have screening recommendations for people aged 21 to 65, and that is when there's no bleeding, there's no pain, we just want to make sure there's nothing else going on. And so that's number one. And then number two is that there is a vaccine available, especially for people with children. We do recommend this vaccine because it does prevent against cancers in the throat, anus, penis, and cervix.
Thank you, Dr. Lin, for this insightful presentation. This concludes our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.